What is iron? Iron is a mineral that the body needs for growth and development. Your body uses iron to make hemoglobin, protein in red blood cells that carries oxygen from the lungs to all parts of the body, and myoglobin, protein that provides oxygen to muscles. How much iron do we need? The amount of iron you need each day depends on your age and whether you consume a mostly plant-based diet. Vegetarian needs almost twice the amount of iron because the body doesn't absorb non-heme iron in plant foods, as well as heme iron in animal foods. Recommended daily dose for boys at 14 to 18 years old must take 11 mg iron per day, while girls at 14 to 18 years old should take 15 mg per day. Otherwise, for males at 19 years old and above must take 8 mg for each day. Females who 19 to 50 years old must take 18 mg iron per day. Other than that, for pregnant women needs to consume at least 27 mg iron per day, while females at 50 years old and above need to consume 8 mg only per day.
What are foods rich in iron? There are two types of iron found in foods. Heme iron is found in meat, fish, and poultry, and is easily absorbed by your body. Non-heme iron is found in eggs and plant-based foods, such as beans and some vegetables. This type of iron is not absorbed as well by your body.
These are some foods that rich with heme iron. Chicken liver has 4.6 to 13.4 mg, oyster has 5.0 to 6.3 mg, clams has 2.1 mg, chicken has 0.9 mg.
Next, food that are rich with non-heme iron are lentils, which has 3.3 to 4.9 mg, roasted pumpkin seeds with 4.7 mg, spinach with 3.4 mg, infant cereal with added iron with 7 mg, walnut which has 0.8 to 1.2 mg.
What will happen if we lack iron? We might getting anemia disease. What is anemia? Anemia is a condition that develops when your blood produces a lower than normal amount of healthy red blood cells. If you have anemia, your body does not get enough oxygen-rich blood. The lack of oxygen can make you feel tired or weak. You may also have shortness of breath, dizziness, headaches, or an irregular heartbeat. Symptoms of anemia. There have 3 stages of anemia disease. Mild anemia. The symptom is tiredness, weakness. Moderate anemia. The symptom is faintness or dizziness, increased thirst, sweating, and weak. In severe anemia, the symptoms is shortness of breath, heart murmur. Anemia treatment depends on their cause. Aplastic anemia. Treatment for this anemia can include blood transfusions to boost levels of red blood cells. A bone marrow transplant might be needed if a bone marrow can't make healthy blood cells. Anemia of chronic disease. Treatment for this type of anemia focus on the disease that causing it. If symptoms become severe, treatment might be include getting blood, called a transfusion, or shot of a hormone called erythropoietin. Anemias associated with bone marrow disease. Treatment of these various diseases can include medicine, chemotherapy, or getting bone marrow from a donor called a transplant.
Who has the high risk of getting anemia? The first one is young children. Toddlers and children of preschool age have the highest prevalence of anemia at 47.4% of their population group according to the World Health Organization (WHO). Children require more iron for growth and development. Children often receive a good supply of dairy, yet this food group is deficient in adequate iron and can ultimately increase the child's risk of developing iron deficiency anemia. Iron-fortified foods like commercial cereals are recommended to children aged 6 months and older to help reduce anemia risk. The second one is pregnant women. Due to greater demands on the blood supply for developing fetus during pregnancy, women tend to suffer from a high rate of anemic risk, with a global prevalence of around 42% within their population group with chronic medical conditions. Long-term illness can also increase a patient's risk of becoming anemic. Diseases such as diabetes, cancer, HIV or AIDS, and cardiovascular disease have been associated with higher prevalence of anemia. Bleeding of the gastrointestinal tract is a common factor causing anemia. In these cases, hemoglobin levels should be monitored via hemoglobin analyzers in order to guide treatment course. Supplementary iron may be helpful for combating anemia. Patients should seek advice from their medical consultants. In summary, women are more likely than men to have an iron deficiency because they lose blood during menstruation. Pregnancy and childbirth can also cause iron deficiency. Supplements and food with added iron are effective methods to help women get enough iron.